Welcome back to Open Your Eyes. This is our first conversation this morning. And as we mentioned, it's all about the importance of physiotherapy after accidents or for accident recovery. This morning, we are joined by Sergi Matos. He is a physiotherapist representing PhysioCare Center Belize. Good morning, Mr. Matos. Thank you so much for joining us.
Good morning. Thank you for having me here.
It's a pleasure.
It is. You know, oftentimes we've documented and highlighted many accidents over the course of the years, and we've also highlighted persons going through recovery. One of the things, though, that I think we often probably don't highlight is what that process could look like for persons. Recovery and physiotherapy, or physical therapy, as some might know it to be. Is this a common, I'd say, thing where persons would access physical therapy after accidents?
There some people that know about it. Yes, they will reach out or they will ask their doctor about it. But on a whole, most people don't know. Most people don't know that to help in speeding up their recovery after an accident or illness or surgery, that they should seek out physical therapy.
Mm-hmm. What got you into this in the first place?
Well, as a kid, I always wanted to be in the medical field. So just studying and continuing like in that career choice. And just while like going to sixth form, I was speaking to doctors, and from there, doctors told me that here in Belize, we do not really have much physical therapists at the time. So then just continuing my research to see where I would go to university, I decided that, okay, in Mexico they had, and so that's where I decided to go to continue to study physical therapy.
Okay. Speak to us about physiotherapy. What's the definition of physiotherapy? What does it entail?
Well, basically, we help in, first we have to just evaluate a patient, and then we have to see how they are. But the main point is to get them back functional in whichever way possible, all right? So we just use like a treatment plan or a program that we set up, and each one is set differently. So it's for each person it's different, but it's just for us to continue, like to help them get back that function, get that independence they have, and just to help improve their quality of life.
So you talk about function. Who goes to seek physiotherapy? Who seeks out this type of therapy? What sort of condition would a person be in? I know we talk about accident, but I would imagine it goes beyond that.
It's more than that,
so
yes.
Who or in what state would a person find themselves in to seek out physiotherapy?
Well, it can be as simple as like a sprained ankle. You can come, because a sprained ankle, if it's depending on how bad it is, I mean, it affects how we walk, how we stand up, and then overall it just starts to affect the posture of the body, and then you start to feel more aches and pains in other areas.
So you talk about sprained ankles. That's perhaps on a more
General.
Yeah. What are some extreme cases now that would require physiotherapy?
You have people that suffer a stroke, and so due to a stroke they have some sort of like temporal paralysis, and so what we do with therapy is to help to gain back some sort of movement and to help that to speed up the recovery. Okay, and then other ones are like any spinal cord injury, depending on how bad it is, because it just, like in a lot of the injuries, it just depends on what grade or like how bad it is, and then from there then we are able to know more or less if we're able to help, and at the same time how long or how quickly the patient can recover.
What experiences have you had or have you seen where physiotherapy perhaps have helped patients to drastically improve their health or their condition?
It just depends on what they suffer from, because some of the illnesses or injuries, it's easily recoverable. So for some people, within a couple weeks or like a month, they look better and like that, and then for some it just takes some time.
Yeah. Is it important for yourself to have a relationship with other medical practitioners, for patients to understand that physical therapy is an option here in Belize? Because as you mentioned, when you decided to get into this field, you recognized that there wasn't enough persons in this profession. A lot of people tend to, for example, in the case of strokes, they kind of feel that, all right, after there's some type of paralysis, this is my new normal. In other cases, you have athletes who there are a bit more, I'd say, maybe certified physical therapists or persons who just go about Googling and trying to figure it out on their own. Is it important for you to have a relationship with other medical practitioners so that patients can know that this is an option?
Yes, we have to, like, for example, we work along with, like, especially like specialists like orthopedists, neurologists, because I mean, when it comes to a stroke, one of the main doctors that that deals with that are neurologists, but then also with orthopedists, I mean, any broken bones, any injuries or illnesses that work along with that, we need to like speak with them to understand what the patient is, how the patient is doing or on their part, and then from there, then we're able to create our program or like our therapy treatment in order to suit that or to see how we can help them overall.
What are some common treatments that has been going through your clinic since you've started?
Okay, I've seen patients with strokes. I've seen patients with just normal like muscular injuries. Like athletes that they feel like a tightness or a cramp, and so I help with that. You have what we call facial paralysis or Bell's palsy that people come with. So basically those are just some of them.
I'm thinking that physiotherapy is pretty hands-on, but that may be a narrow view. So I'm thinking, all right, you come in to your physiotherapist, a crack and leave bone there, a twist one lead joint there,
make you lift your foot,
a massage and leave it, and so that's I'm thinking hands-on. But I'm saying that may be a more narrow view than it actually is. Are there equipment, machines involved, medication and prescriptions as well, technology? Speak about it from a broader perspective in terms of all that is involved, especially if they go to you.
Well, we do have equipment that it just helps us, it facilitates us in helping with the recovery of a patient, but still most of it is hand-on. Okay. They like electrotherapy equipment. Those are machines that like just create little stimulations and like that to the body. All right, and so then that just helps overall, but it's not to say that, oh, we just will apply that and then that's it. No, because we have to deal with like exercises as well, because each whatever the patient is recovering from, their specific exercises we do to try to help to like focus on that so that they can continue in their recovery.
Okay, so you're using equipment, medical equipment, and there's also a level of exercise that would be involved for a certain patient. Is it that they come and you monitor the exercises, how they're progressing, or is it something you tell them go and do at home?
Well, we show them, we work with them, but then whatever we like give them, like when it comes to exercises, we tell them they have to complete it at home, because you have to look at it like this. If they come, let's say you see them twice a week, if they don't do anything for the next 3 to 5 days of the week, then
it's not enough.
It's not enough. It takes away, or it doesn't speed up as quickly as you want it to.
Yeah. So for persons like in perhaps the most extreme cases that would have had a severe stroke, right, and perhaps have lost some ability in their limbs to walk or to move their hands or to speak or to move their facial muscles, there are exercises that they can employ. Is that like in the initial phase or a while after they've sought treatment elsewhere?
Well, we mainly have to get the all clear from a doctor first. Okay. So their attending physician has to tell us, yes, we can come in and start to work with them, because we don't want to start and then you start to have more harm on their body than like if their vitals aren't stable, things like that, we can make them more unstable. And so we need the all clear from a doctor first, and then from there, then we can then start our treatment plan.
So
What role does physical therapy play in pain management when it comes to recovery?
So what we do is, I mean, when there is pain, it always says, okay, there's something wrong in the body, right? So with therapy, we always have to see what the cause of the pain is, all right? If it's just maybe because the muscles are weak, or if the joint is, or like if the joint is stiff, then from there, then we just see. Because if it's just that, yes, over time, the pain does go down, because it's just, the body's just saying, okay, we can't do it at the time. But as you go along, or you progress in the treatment or in the plan, then you see that it becomes less and less. But you know, if it's from another field, then that's when we recommend them to see their physician.
is there a age ceiling in terms of seeking physiotherapy? Perhaps a point comes when your joints are they're just what there is. They're just what they are, man. You're older now, and they're just giving way naturally.
Well, there is no age limit, all right? Normally, like with that joint, or like that, you know, you're saying with the joints, what we would do mostly in that case is just, like if it's a form of arthritis or something like that, we just would deal with the pain and to help with any inflammation. But if it's at a level where only surgery can be fixed, then that would be the only option. But what we would do only then is to help with any pain management and like to reduce it.
So I see physiotherapy has a lot to do with getting you back to your best self, or as best as possible physically. For a lot of people, it's recovering to a point where they once was. How much of it also has to do with your mind, mental versus physical recovery?
It has to do a lot, because you could already get the all clear from the doctor, you could start the treatment plan with them, but if the patient isn't motivated, it will take longer. The process is longer, because you reach a point where they have like a sense, they feel hopeless. You would be doing the exercise with them, and they'll be like, why continue with therapy? I don't feel like I'm getting better, and like that. And so during that time, we just have to be compassionate and just have patience with them and try to motivate them.
Yeah, I mean, and that's what I was going to get to as well, because how do you motivate a patient that feels that way, like, man, I give up, or this is really hard for me, while I've enjoyed walking and talking, and now I can't do those basic things. I have to relearn it all over. How do you motivate a patient?
I try to make them still be as independent as possible. So we do, like my exercises, yes, I will help them, but then they have to try to do it themselves. But at the same time, like I would tell the family or the friends that when they're at home, try to let them still be as independent as possible. Because before that, most people are doing things on their own, before an illness, before the injury, before an accident. And so when they reach that point, it's like, okay, now I can't do anything. So you have to try to just keep them still as independent as possible. So make them still feel like they have some sort of use or function in the household or in their family.
Are there cases where there's nothing you can do for a patient?
When it comes to that, like if a patient has like a spinal cord injury, they might have paralysis depending on how bad it is. And if it's a complete paralysis, then we really can't do much. All we recommend is like for the family members to just keep moving the patient, things like that, to just not have any like side effects present, or like which could be like bed sores or stiffness of the joints, things like that.
When it comes to physical therapy, is it dependent on the time that you go about seeking the actual therapy? I say this in context to perhaps persons who would have gotten a stroke and experienced some type of paralysis, or persons who would have been in accidents and the same thing occurred. Is time an important aspect in when you go about seeking therapy?
Yes, it is. the sooner the better, but we still have to wait for that all clear from the doctor, because we can't, if the doctor is seeing that your body or whatever is not in the condition to start therapy the next day or something like that, then we don't start. You shouldn't start.
So an example of that is perhaps maybe someone who experienced a gunshot injury that paralyzed them. Some might pursue physical therapy, but maybe they weren't able to afford it, and years pass and they're now completely paralyzed. Can you go back and try to start over from scratch? Would that still be effective, or in some cases is it too late?
If it is a complete paralysis where there's nothing that can be done, like let's say for the legs, then no matter how much therapy we try with therapy, we won't be able to recover any movement whatsoever in the legs. But if it's just like what we call partial, meaning that it's only a temporary sort of paralysis or something like that that can be recovered, then yes, it does. It does take a bit longer because of the time frame from when they started therapy, from when they had injury to when they started therapy, but they can recover.
How different is your approach to a high-performing athlete that may have experienced a season-ending injury versus somebody that may have been experienced a stroke or been in an accident?
Well, you have to see, because like with athletes, you have to remember that's their, like, let's say their job and their livelihood. So then you have to like start your therapy and then focus it mainly on getting them back to that level of being back to where they were before the season ended.
Versus just mobility.
Yeah, versus just mobility, like for people with strokes. With strokes, we just want them to start to be moving around, try to get back that strength and that function and that use of the limbs that have been affected.
So you've seen high-performing athletes come through your doors and seek out your services?
Yes.
Okay, that's quite interesting. Now, where are you located for people that's interested in?
I'm located on Sundial Avenue, which is by the Belize Bank on Coney Drive. Okay. My business name is Physiotherapy Center Belize.
Okay, I've passed here a couple of times. Do you also prescribe medication as well?
No. So my career, or what the length of time that I studied, I never did get much into the pharmaceutical field, or like a lot of pharmaceutical education. So because of that, I am not licensed to prescribe any medication.
It says on your business contact that you also do for children as well. Yes.
Oh.
Talk about the difference between providing physical therapy for babies or pediatric physical therapy versus adults.
Well, I mean, with adults, they can follow instructions and like that, but with children, you have to try to make it a bit fun. So then whatever program you have to try to create it, like maybe in games or in some sort of like, that might make them just not feel like it's actual exercises, you know? Because for them, they will get bored. For them, they will start to cry and be like, oh, they don't want to continue. And so it's just, there's a big difference when it comes to that.
I want a word that came up on your flyers, sciatica. I think, well, I know that I had some issues in my lower back, I think, lower leg, and they used to say sciatica. I've been exercising for some months and that pain has gone a bit, but what causes sciatica? How would you define sciatica? Because some people might be experiencing it, some people hear about the term but not sure what that is.
Well, you would have to see where the actual pain is located, but most of what we call sciatica is just because the sciatic nerve is pinched in some way or compromised, and so then that causes a pain that radiates like down the foot, and for some people all the way down to like the extra, like to the toes, and it causes them to not like move easily, like they move slowly. So when it comes to that, we just have to see what it is, and then you just do certain stretches, or we use some of the machines that we have, and then it's to just like to relax the area, because we need to let the nerve not be like compromised or pinched at that moment.
So how much How much times have you had to perhaps recommend to patients to include a level of exercise and more physical activities in their daily routine to kind of combat some of the challenges medically that they're facing?
Basically, every patient that I've had, I've given them their what I call like homework, which is their exercises and their stretches to do at home when I don't see them.
One of the things that I've also heard is how important stretching is in general. I mean, you find a lot of people come to you and you give them specific movements to do to ease some of the pain or discomfort that they have. But in general, would you say for younger and older persons, as you get older, stretching and these types of movement, are they important for you to do on a daily basis?
Yes, it is, because when we get up, you have to remember we are logy, we are slow, we're sleepy. So then we need to stretch. We need to stretch out the muscles for them to be ready for the day, for us to do all the activities that we have to do.
Yeah.
And then in the night, we should stretch again to relax the muscles, because we want to just feel, we want the body to be as relaxed as possible before we go sleep. And
What
so
are some
just
stretches that you would recommend to our viewers tuning in right now? It's early in the morning. We have some viewers staying at home, and we have some viewers who are getting ready to start their day. What are some movements that you would recommend for us to do in the morning to prepare our bodies for work, and then at night to prepare our bodies for rest?
It's like what we would recommend in like a warm-up exercises. So like normally just rotating the shoulders backwards, forwards. You stretch the elbow like this. You like just take deep breaths, because you have
We
to
should
stretch.
do that as an exercise, guys. Did you stretch this morning, Paul?
I woke up and I stood on my 2 feet, so I stretched
Let's
out.
do that exercise this morning, Mr. Matos, as we wind down the
Yes,
conversation.
they're putting me some others on the
Yes.
spot. I like it.
So what are some, and guys joining us, please, if you have not stretched yet this morning,
These are sitting stretches.
these are these sitting stretches?
Some can be done sitting, and
let's
some
sit.
will
Let's
Let's
do
do
the
the
sitting
sitting
one.
stretch. But
Don't
let's
do
do
the
the one
standing ones,
where you
but
don't
I'm just
stand up.
saying,
All right, let's do our sitting stretches, and then you can
Okay.
maybe just share with us what are the standing ones you're supposed to do.
Okay.
All right.
So basically, we start off like we're just rolling the shoulders backwards, slowly.
Dang, I'm stiff already.
Yeah,
I
yeah.
needed this.
Actually, I
And then
like
what
that.
you do is you sometimes feel like the shoulder blade moving in and out.
Yes.
So you feel the tightness there.
So how
That's
much
normal.
of this should we be doing in the morning?
Yeah, minimum of like 10 to 15.
Okay, 10 to 15 guys you should be doing in the morning.
Then you
Forward
go
and back.
forward afterwards.
And then another 10 to 15
Yes,
forward. Okay.
Slowly, and then from there you move on to the elbow. So we have to stretch up, because then at the same time we stretch out the whole shoulder.
Ooh, that's a good stretch right there.
And then you do the same. You would
And
hold
how
it.
much of this?
You hold it like for 5 seconds.
Okay, 5
And-
seconds.
And then you do the same thing. You do around 10. It depends on how you feel after, but at the same time depending on how busy you are, because for some people they don't have time to do 10 or
Man,
15.
needed this.
I know. You're
I
welcome,
do-
Paul.
So I'll do 5.
Uh-huh.
Even if they can just do 5, it's good.
Yeah.
All right.
So that's upper body. We just did 2 exercises.
Well, we also have to include breathing, because you
Yeah,
have to remember to breathe. We have a lot of muscles in our
Wow.
chest as well, and so then we have to take like deep breaths slowly. So then you just breathing through your nose, and then slowly out through your mouth. And you just repeat it like a 5 times. But this one, when it comes to your breathing exercises, I would recommend you do them sitting down,
Okay.
because sometimes doing this you could get lightheaded. So then
Oh.
if you get lightheaded, you don't want to be standing for it.
So we should be doing this the moment we wake up in the morning?
You take it, yes.
Okay.
This is like a lot of preventative care, right?
Yes, because I mean, as growing up as teenagers and kids and young adults, you feel like, oh, you could just jump out of bed. You could be like, oh, I feel good.
Yeah.
And
I
then-
know I lie to you, Sergeant. In my young age, I get up out of bed and I feel a little twist sometimes here and
And then
there.
and then later on in life, you feel it and you're like, man, I'm not as flexible as
Exactly.
before. This thing
30s,
hurt
is
me
that
again.
you? But that's just some of the exercises you can do standing. Perhaps you can just explain to us some of the things you can do if you're standing.
Okay, so like for example, you can just go, you can go down slowly as far as you can go
Bend?
to touch your toes.
Okay.
All right. Because what you do is you stretch out the back
Your
of the legs,
hamstrings.
your
Yeah.
hamstrings, and then what you do is you hold on and you go up slowly on your toes.
Okay, so your
you come down
calves.
slowly. Yeah. You have
Okay.
to stretch out the calves. You just do the ankles. You turn the ankles.
Okay.
Well, this one is sitting. If not, you will hurt yourself. Our next exercise we can do sitting, which is for the sciatic, is what we call the number 4.
Ooh, what's a number 4?
You put the foot up if you're as high as you can, and then you just lean forward,
Oh, that's a good stretch.
yeah.
and
That's a good
you'll feel the stretch at the back.
Okay.
All right. So then these are just stretches, and you can do this on a normal because especially for that one, if you do it on a normal, you will prevent any like sciatic later on in life.
Okay. And then for nighttime, those same movements again?
Yes, you can do the same ones. For those who do yoga, they can do yoga to wind down. So then that helps us about it to be in a relaxed state before we go sleep.
One of my favorite stretches is just laying flat on my back and closing my eyes. That's just the best stretch I could think of in the night.
I can agree. All right, Sergi, this has been a wonderful conversation. For persons who would like to reach out to you, whether it's physical therapy or just doing checkups on how they can ensure that their bodies are in the best state possible, how can they reach out to you?
They can contact me through call, through WhatsApp, or through text messages on my phone number, which is 613-4268. They can send me a message on my Facebook business page, which is the same thing, Physiocare Center Belize. All right. And then, well, they have my email as well.
All right.
All right.
Wonderful.
Excellent.
Well, before we take a quick break, we want to include you in our motivational quote this morning. And this morning's motivational quote is, "You will never change your life until you change something you do daily. The secret of your success is found in your daily routine."
Good
And this
stuff.
comes from John C. Maxwell.
Oh, nice.
Beautiful.
My favorite author and public speaker.
All righty. All right, we take a quick break now, but don't go anywhere. When we come back, the next conversation is business meeting innovation at the Expo Marketplace 2025.